But it says setting up YouTube Live, so I think it'll usually by then.
Okay, I'm gonna call the meeting to order now at 7:32.
Adequate notice of this meeting pursuant to the Open Public Meetings Act is posted on the bulletin board at City Hall. The city's webpage is distributed to the record and filed in the office of the city clerk. Thank you.
To the flag, United States of America, and to the republic for which stands one nation under God.
Independent, indivisible, with liberty and justice for all.
Okay. Ms. Bostic? Here. Ms. Rubin? Here. Dr. Sadler? Present. Dr. Sofer?
Yeah.
Mr. Tenzer?
Here.
Ms. Davis?
Yeah.
Moving on to item 2, items for approval, which is the board's consent agenda. We'll vote on double items A through 2A through 2D, which includes the minutes of the June 11th, 2025 meeting, revenues of June 2025 of $22,109, $22,280 in July, and $21,870.50 in August. Expenditures of $1,263.26 in June, $2,340.88 in July, and $6,040.57 in August. And the employee reports for June, July, and August. The board will need a motion and approval to second.
So second.
Ms. Bostic?
Yes.
Ms. Rubin?
Yes.
Dr. Sadler?
Yes.
Dr. Sofer?
Yes.
Mr. Tenzer?
Yes.
Ms. Davis?
Yes.
Moving on to item 2E, retail licenses for June, July, and August 2025. Is there anything about these licenses that the board should be made aware of?
Aside from a number of them licensing late, no, if there's no other issues.
Were they receiving letters, notifications that they were late?
These did all pay a late fee, everybody that's on these reports from June.
To item 3, reports tonight. Item 4, committee reports. Are there any reports from any committees this evening?
Personnel has a discussion later.
No question, but I think it concerns the closed session.
All right.
It was my turn to attend the council meeting. And it's in my report. I attended on August 5th date. For about the first 30 minutes, there was a lot of handshaking and picture taking with the Inglewood Business Apprentice Program. What was nice is I saw Mitch Schoenfeld there and Carol Rauscher. I haven't seen them since I left Inglewood. And then Franz Volse talked about the Grand Avenue traffic and construction there. It was an informative piece of informative talk that he gave. How they're trying. There were a lot of complaints of speeding on Grand Avenue, which is odd because every time I'm on Grand Avenue, there's so much traffic. Who could be speeding on that? But they implemented some measures with marking and striping to get the traffic to slow down in that area. So that was the extent of the meeting. It's 3 hours long though.
Moving on to item 5, old business communicable disease update, Ms. Baldwin.
Well, I think she was froze, but I wasn't supposed to be here at this meeting, so she was gonna handle it. So maybe you guys have seen, I think everyone saw about the measles case that happened reported on in Bergenfield on August 31st. It was a confirmed case. And the person who lives in Bergenfield attended the daycare here in Inglewood. And of course, that set off a whole slew of contact tracing to inform people that they had a positive exposure to measles. So the infectious period was August 22nd to August 30th. And the child attended the daycare over here at the Bergen Family Center. And that's where the exposure occurred. It was on August 22nd. So the all clear period will be 21 days after that. So I think in next September 12th, there are no secondary cases. We've made it through. So we're pretty close. So far, there haven't been any secondary cases associated with the index case in Bergenfield. But really want to thank Deepika and Claudette for handling that at the Bergen Family Center, because that was a lot of contact, a lot of talking, a lot of meetings, and it happened over the Labor Day weekend too. So just a lot of work, and also thankful of Bergenfield, their nurse staff over there really helped out a lot. So.
Job doing.
Very well. Yeah, very good. So big improvements there. And this would be Claudette and I's second time, because when I was the health officer here, there was the case right across over there above the CVS. We had 2 cases of measles. That was back, maybe 2018, we had 2 cases of measles there. So that's the communicable disease report.
I just have a COVID update to add to that. And this is for June, July, and August. There have been 37 confirmed cases by PCR tests, 45 by antigen tests, and the age groups from 0 to 4 years old cases, 5 to 18, there were 2 cases, 19 to 64, there were 56 cases, and 65 and over, there were 21 cases. We had 3 hospitalizations and no deaths.
Moving on to item 6, Le Gourmet Rent a Kitchen, Ms. Baldwin.
The owner of this establishment came to meet with the senior REHS and myself after the ordinance was passed to create a fee for the individual kitchen units. You were sent his original proposal when he came to meet with us, and also a letter that he sent to us after that meeting. So he was basically asking you to reconsider the fees. I told him, that that's entirely, and whatever you think, we will go forward with. He was told about the meeting tonight. I don't know if
He's not here, Deborah.
I don't know if he's attending remotely. I don't see him. So, I mean, it's up to you whether you want to consider his proposal or not.
Has everybody read it? It was in the packet. Everybody get it?
I did.
I'll take a look at it.
We have it there too.
It was a longer one though in the packet, right, Deborah?
Different tiers.
There's a lot of options and.
But the letter that he sent was quite a bit more concise.
So in the sense that he's bringing in individuals, I understand, that helps the community, help people out as entrepreneurs, but he's also increasing his revenue in his pockets by doing this and increasing the number of people he brings in. And we are only charging him one flat fee as that brick and mortar structure. I do not see a reason to decrease it at all. If anything, increase the cost to spread it out. And he would then have to figure it out for the individuals. We do the work, the individuals here doing the work and we need to increase it, if anything, but not decrease it at all. That's my opinion.
You know, he also mentioned something about doing more than one inspection at a time. How do we feel about that instead of like one by one to do a group? He
Then
said
you
it's
end up
less
getting-
disruptive.
And you end up getting different people coming in at different times, and who's to say they're continuing or they're bringing in someone else and it's a quarter. He can stack in 30 more people and they never get inspected. That's my thought. I don't
Yeah,
know.
there are new people, you know, at different times during the month, so I don't know how they would do that because they need to have a pre-opening inspection.
Absolutely.
Any thoughts?
What did, I remember working through this, but what was the initial fee? Or did we not have one in place? Do you remember what,
I'd have to go back and
What
look,
was
'cause
it?
we're at
Deborah?
1,500 now.
right,
That's Deborah, what was the initial fees for the individuals? Was it still? 70?
Originally, they did not pay a fee to the health department. They had to come and fill out licensing forms, but there was no fee for the individuals.
The brick and mortar fee of his establishment of 1,500 for the year?
Yes,
I think that,
wait, he always had to pay the 1,500?
yes.
No matter how many people. No matter how many kitchens.
Yes,
Is it-
regardless.
It was based on his, like, he had 5 kitchens set up, so we decided it's gonna be $1,500.
6 kitchens. I just thought it was just based on the square footage is what I was thinking, based on other restaurants and other establishments and what they have. I don't know how
I
big
think
it
it
was.
was, we did it by, he had 5 kitchens, but he's reconfigured that business since then. It's gone through some changes. But then we just kept the 1,500 be the same.
So I still think we need to have a licensing fee for those individuals coming in, because they're coming here to seek a temporary license for however long that they're going to be housed at his facility. But that individual needs to be inspected, and there should be a fee associated with it. I don't think he should just have one fee. He's collecting from them. He's paying for his business, but we're doing additional work each time a license has to be distributed.
Yeah, he did say in the letter that he wrote that he surveyed the members that he has and said that they'd be able to afford an additional $95. That's a fee for us for a 1-year license and 75 for a 6-month license, and leave the $30 10-day license as already passed. I don't know if they actually have any. Yeah, they do actually have a couple of people who just go in and out periodically. So I guess that's the last thing that he proposed.
So Deborah, I have a question. I'm a little confused. So the $1,500 annual fee is what he would pay. Is he proposing additional money from each of the vendors that work within the kitchen?
They are willing to pay a temporary license fee of $30 on behalf of each new member and pay it quarterly, is what he said. Yes.
In addition to the 1,500?
Yes.
Okay. But he's paying the 1,500 and they're paying the 30 or the 95 or the 75? Because you mentioned
Well,
something.
no, this is instead of that. I think he's requesting ultimately that the 1,500 remain the same and that they will pay $30 for each new member that comes in on a quarterly basis.
I think more is generated on our manpower going out there on either monthly, quarterly, or whatever period that we're going out than $30. I'm sure that inspection takes more than 10 minutes. $30. If anything, I would take it to $200 a quarter or something, but not.
Have to look at the inspection report that they generate with their reports each month to see if you can actually see which ones are associated with Lake Gourmet. They are by the address, but I'm not certain. I'd have to look at that.
We could just maybe do a survey of how many he's had over the past year, how long that they're there for. Is it a 10-day? Does he get in 50 people in a month? Does he get in 50 people in a quarter? I think further evaluation needs to be done at this time.
I know that they're supposed to provide us of members. I think it's on a monthly basis. I will see if I can get that from the REHS.
Because don't his numbers change based on when there are events? The night market,
Yeah.
the Juneteenth, the holiday celebrations, he has no
Right.
consistency. I'm not saying it's good or bad, it's just the fact of the way
Yeah,
it
you know,
goes.
that's an interesting business because, and there were always complaints because they would have people come in, Priscilla would go there, or a health inspector, then they're not registered, we're like, who are you guys? We never saw you before in there. So there's always been differences between our agency and the Gourmet Factory. And I do know that the business serves an important purpose in our community because entrepreneurs do go there to test out their products. And if they don't do it there, then they end up going underground. So it's good that Nick Prastos, the owner, offers this service. So we just kind of have to find a happy medium between us and them. And of course, Nick is going to advocate for his business and his clients
I
at a lower
understand.
price. And then Priscilla's like, we keep going back there and we're always going there and always
I just think
finding a
it's
problem.
too many times that they're
Right.
traveling back, and I feel like
Yeah,
the health department's not being compensated.
Right.
Nick is being compensated, but we're not.
right.
So that's why I say, look at how many times it's been done, go back 6 months maybe, or the summer, or, I think we need to look at it a little differently then. I don't remember the numbers, but I remember when we first started with Nick, and it
Yep.
seemed like it was only a few people, then it grew.
He's grown.
Why don't, is it possible to charge just for every time Priscilla goes out to, inspect? Maybe
Well, that's
it's,
what we were saying.
but I'm saying instead of it being like, every 6 months or whatever, like literally each time she goes, there's a fee.
Right, that's what I was asking
And-
the question. Is it a flat fee or is it like a per diem kind of thing?
If they want to be in the facility, there's a fee because they need the inspection. So she has to go out to get the inspection before they can get their license.
Right, but maybe it's Nick pays the fee each time and then he charges it back to
It's up
whoever.
to him to.
I'm just saying like, come up with like just a consistent fee for her coming out versus a 1 year, a 6 month, a 10-day. Like it's per
Yeah,
visit
that's a
versus,
That's a good point. I can't remember why this is like that. Maybe some businesses are there saying, okay, look, I'm gonna be here for a whole year. And some people, I'm just gonna be here temporarily because I have an event coming up, so I just need it for the weekend. So why should I pay?
Okay, so,
Yeah, that's how
I'm
it
gonna say
started.
Rita's Ice Cream is a small little place and I saw it I think they're paying like 300 or 250 per year. And if somebody else is coming into Nick's establishment, and they're only there for a month, I don't know, we can figure it out, but I think there's gotta be a happy medium, maybe somewhere in there, but we just can't, say, keep going, Priscilla, keep going, whoever's doing the inspection, and we're not getting the compensation, or
Mhm.
we're on the losing end, and we're steady putting out the services.
Yeah. So Deborah, was the ordinance passed already for the fee increases? Or is this for next year, 2026? He wants to do this.
Oh, we passed it.
Oh, it's already passed, so
He's read it
he
more
wants-
than once, so it's
It
most
seemed like
likely
we
passed.
did, I
so now he wants
We
to,
passed it.
amended.
yeah, I think he should come here and talk to the board then.
Well, I think we should also then collect our information too, then, so we have time to have what we've done, what we've received in the past. These are the figures, and he can come with this proposal. Maybe we can, or you, so, I don't know.
Deborah, he's not on the line, can you see? Or Paula, can you see?
No, I don't see, yeah, I see other, and then there's another person I'm gonna make sure they're.
Thing we need to collect
So we're gonna
information.
table this and collect more information from him, invite him to the meeting. Wait a minute.
Uh-oh.
Gotta add the buns. Now who's ready to eat me?
Okay.
Never seen that.
This is not.
That happened in Bergenfield one time.
Hansberry County looking for.
Yeah.
Example, what it could have been better.
Moving on to, item number 7.
We're in dull moment.
Ms. Baldwin, is there anything about grants you want to discuss? Yes, we lost her.
Oh, she was saying she
Yeah,
was
she
having
is.
struggles she had
She doesn't want
texted
to
me.
say it, so hope we get it back.
There she is.
He's muted.
Deborah, you're muted.
She might not have heard us.
I'm sorry, I'm having a terrible time with my connection tonight, so I keep losing the connection and getting logged back in. Patient
We're-
with me. What
Is there
did,
any grants
did you
want-
direct? Oh, yes, grants, okay. So the first thing is that the New Jersey Department of Health, they extended the Strengthening Local Public Health Capacity Grant to 2026 fiscal year. And let me see if I can find the total amount, 64,088 for this fiscal year coming up, which started in July 1st. We have been approved for the Radon Awareness Program, which allows us to give out radon test kits to the public. And the NJ grant, the initial amount was added to 24,950, making the total award 193,000. This is the grant that expires March 31st of next year. So now we're trying to work out a budget amendment to use these funds that we just got. And the last thing I have is the Mayor's Wellness Campaign has a mental health initiative that we are applying for. The just amount available is 15,000, so that's what we will apply for. And the application is due next week, so we're still working on that. That's all I have on grants.
Another question. So, in Julie's report, it was talking about she spoke with Rebecca Olkers, VP of Clinical Services at Care Plus, regarding social and
Yes.
mental health services. Are we thinking of using that grant money, some of that grant money? It's hoarding, homelessness, social service cases. Can we use that money for our social worker?
It is an eligible expense. We're still trying to work out what a per diem rate would look like, so we know, what to put in the budget amendment. And the hope, obviously, the city would, if we get that in the grant, that the city would continue that service for us. The other option is, I think that the Community Development Block Grant allows that expense also. And I'm waiting for the next application period to check on that and then apply for that if possible. So the answer is yes, we can use those funds, have enough funds to cover it.
Okay.
We're still working that out.
So the funds would not be used just in salaries then.
Yeah.
The radon test kits have been ordered, or you're waiting for the funds first?
No, it's a reimbursable, like all the other grants that we have. I think we're just waiting for them to deliver them at this.
I'm just thinking about the health fair.
I,
Family
I'm not
festival.
sure. I'm not sure if we'll have them by then. We'll hope for it.
By January then.
Yes, absolutely. We should have them by then. Yes.
The new business item number 8, public health events and outreach. Alden.
You have several flyers on upcoming events. One was just finished today. You have that in front of you for the health fair. The only thing that I would add to that is I have the health educator prepared an after action report for the water wellness program, and there was much positive feedback. There were some suggestions made.
You mute him at least until, okay.
I'm just reporting them and removing them. And I won't admit nobody else.
Okay. Feedback on the facility. Most of the ratings were 3 to 5, which 3 to 4, which was satisfied with it. They said it was clean and well maintained, good size, the lifeguard presence they were happy with. Some of the challenges with the facility, they said, were bathrooms and changing areas need updating. For instance, mirrors, safety bars, and more shade outdoors. I don't know how how we would arrange for that, but anyway. And sometimes the pool was too cold in the evenings. I can sympathize with that. Most of them said about accessibility and accommodations. Most said that their needs were met. And a few noted that they needed help with pool entry or had difficulty attending daytime classes. Overall, the feedback, I will send you a copy of this full report if you like.
Overall, I think it was very good. I did attend. And yes, it got too cold, just to drop in the evening, and I thought,
Yeah, after all those 90-degree days, all of a sudden it was 60 in the evening.
no way I was going.
Moving on to item number 9, Board of Health Attorney, RFP, Ms. Baldwin.
Okay, believe it or not, 5 years has come and gone, so we have to do a new RFP for attorney. You all will need to decide whether the Personnel Committee will handle the review of the applications or whether you want to elect a review team separate from the Personnel Committee. So you can think on that a minute. The issue date for the will be September 19th, so it'll be posted online and in the newspaper. The proposals will be due October 17th. An evaluation of the proposals and award of contract by the board by October 31st. And then we should have a resolution at the November 12th meeting to award the contract to them. This will be effective January 2026.
We propose to keep the standing contract as we did in the past. Can go back 5 years and say we did for several years.
Everyone is looking at you. You don't know.
I don't think of that. It has to be a RFP.
Okay.
So do you committee to handle this?
Okay.
Or do you want
Yes.
to do? Yes,
I'll
okay,
contact you tomorrow.
all right.
Okay, Item 10, shared services, Ms. Baldwin.
I guess that's my piece there, Deborah.
You can take it, Jim.
So, the contract that Inglewood has with Mid-Bergen Regional Health Commission is a month-to-month contract. And my proposal is that Inglewood join forces with Bergenfield to have a shared contract with them. And maybe you could find a health officer that will take the position for Inglewood and Bergenfield. And maybe we could also lure in Dumont. And the idea would be that 3 towns combine so that they could offer a good salary to attract a health officer. Mid-Bergen's niche is not, for these big cities, because you have a lot of staff. You have 5 people in the registrar's office, and we need a manager here. And Mid-Bergen can offer that. I suggested Bergenfield because Bergenfield is also a large town. They have additional staff, and I think would be a good fit. Guys, the towns border each other. And so that's what I suggested that to Inglewood board. And I suggested it to Bergenfield's board yesterday at their meeting, and I suggested it to our board, the Mid-Bergen board as well. And so far, there's just kind of like, it's an idea. And examples of this are already here. You have Richfield and Palisade Park that have 2 towns, they border each other, similar populations, and they have 1 health officer for those 2 towns. And it works. So it's an idea that maybe guys would like to entertain. That's all.
So Jim, this is health officer, not director, not health officer / director.
Well,
No, she asked on.
Okay.
oh, she,
Hello, Lisa.
Hello.
Yeah, she's,
Oh.
yeah, she's.
What was the
I was saying, we're talking health officer straight, not health officer / director like we had before.
So in my position last time, I was the health officer and director for Inglewood Health Department. Right now it's health officer and director. I mean, you could do a combination of that. And Mid-Bergen's also, our goal is to help towns out. So right now, we kind of are almost like renting my license, which is the health officer license, so that you're in compliance with the New Jersey regulations. So Mid-Bergen could do that, but to manage and look into the facility is difficult. I don't have the time to do that. And there are 17 towns that we have now. It's easy, these small towns like Closter, Inglewood Cliffs, Carlstadt, that's what Mid-Bergen is geared for, those smaller towns. But not towns with a hospital. The amount of birth and death certificates that are coming through here is a lot. It's a lot of work.
is that more director or the officer?
Well, I would say the director is the person who's supervising the staff and taking care of the day-to-day operations. But you also, to be in compliance, you have to have a health officer's license. And that's where it gets a little bit more difficult.
That's what I'm saying, isn't it easier to rent the license, as you say, and hire
Yeah,
a director? Right.
That's a good point. Hire a director who could manage the day-to-day operations. And it'd also go for in Bergenfield, because they have staff too that need to be supervised.
Presently, Bergenfield does not have a health officer.
They have Mid-Bergen.
And Dumont.
Dumont is under the county, but they've expressed interest. They have a contract with Mid-Bergen to provide child health clinic services with them. So we've already started to build a relation with Dumont.
What does Bergenfield do for a director? Do they have one, or?
They don't.
Are there any health officers to be had? We've been looking for a very long time.
There's none. I see the Passaic is looking, there are 3 other towns nearby that are looking for health officers.
Have we advertised
One
for
is
just the
Passaic.
director?
I don't think so, Deborah.
No, it's been for Director Health Officer.
Oh, slash.
Candidates, worthy candidates, if we just look for a
There have
director.
there have not been any.
So the ad's still out there?
Periodically, I mean, I can't say that it's been running the whole time. I have to keep looking back on, for instance, the League of Municipalities website to see whether it's expired on there and we have to do a new one. Same thing with the New Jersey Health Officers Association and the Environmental Health Association. You just have to keep up with, whether or not it's still being posted. It's still on the web page, absolutely.
Do you have anyone still pending taking the test that we thought was worthwhile?
Not at the moment, just sort of out of commission for right now, I think.
No,
Okay,
interested.
for her for that
So
position.
you could always hire someone as director with the idea of bumping them up once they become an officer too, and in the meantime, you have the rent the officer.
Which might be something to talk about in closed session on the personnel, it's a thought. Not for now, though, it's not feasible now.
Moving on to item 11, executive secretary, resignation.
Um, there's not much more to say. You have a copy of her letter. The only additional information I have is that she got a job with another municipality.
Doesn't
Um,
clearly, who is it?
it's a person who's in the vital statistics area. Her title is Executive Secretary Sub-Registrar.
Thank you. That's all I needed.
Ms. Butler, is there any other business to discuss?
I do have two things. One is, the staff now has access to Dropbox that's been set up for us, and this is to take the place of the file server that's been in our office for a very long time. We are currently the administrative staff and I are trying to consolidate some of the files because some people there could be one file, say a form that needs to be filled out and everybody has it in their folder. Instead of going shared folder and accessing it from there. So we're trying to take care of that. And one of the other things that we want to try to do is set up a folder for the board so that you can access the staff reports and all the other reports that you get by email, which is a lot. And so you can just go to the Dropbox and, open it up and print out a little bit if you want. So we'd like to start that as soon as we can, and I only need to.
I guess.
That's what you were wishing for.
Yeah,
I think so.
sounds.
All right, Deborah, we lost her for a second. Yeah, she'll pop back in.
Moving on to public comment.
There she goes again, okay. Debbie, you back?
I'm sorry?
Are you back? We didn't know if you were finished. You froze for us.
Lost it again. Okay, is everybody okay with, just using Dropbox rather than have everything emailed to you?
That would be excellent.
Okay. Okay. And the only other thing I have is I will be attending the municipalities conference in November. Somewhere here I had a list of all the sessions that I intend to go to, but I can't find it. So I will just put it in my report. I do have a full 2 days planned for sessions to attend that it should be useful for you as well as, the city in general. And that's all I have in.
Moving on to public comment, the board will require a motion to open the floor to public comment, a second and a vote. Speakers have 5 minutes and must state their name and address.
So moved.
Second.
Oh, yeah, it's,
Ms. Bostic,
Yes.
Ms. Rubin,
Yes.
Dr. Sadler,
Yes.
Dr. Sofer,
Yes.
Mr. Tenzer,
yes,
Dr. Solomon,
Yes.
Ms. Davis.
Yeah.
And we have two guest speakers here. If you guys can state your name and then your address, just the street.
Ava Radigan, that place in Englewood.
Thank you.
Stephen Weinberg, Broad Avenue. First thing over. Yeah, public comment, you have a comment?
We had a question. We attend other meetings, like city council, and they publish, when it is a Zoom call, they publish all the details of the Zoom. So, we were not aware that that was a capability or a possibility because it's not on your agenda or instructions. So we would kindly ask if that could be made public through, through the documentation that's on the city website. Because we'd love to attend this stuff. So that would be item one. And then, and I have to admit some ignorance, so please bear with me. I did not get the idea of the inspections for like Les Gourmet. So my question would be, how frequently do other restaurants get inspected? And then the question is, are you inspecting the restaurant or the personnel or both? So is it a requirement that anytime a new person comes in, that they get inspected? For instance, you talked about Rita's. If they change staff, does that require a new inspection, or it's the same establishment and therefore it's just one inspection? And then I don't understand how frequently that gets inspected. So that would be another question. I would think that you guys, and again, respectfully, might want to have a very, very specific list of questions for the owner of Les Gourmet, so that this could go very smoothly, discussing fees, etc. And then the other part is, I noted that you have revenues and expenditures listed, but no detail. And when we do go to the city council meetings, there's a great amount of detail there, so we can actually look at this stuff and understand where the revenues are coming from and where the expenditures are going to. So we would kindly appreciate that, so we could be better informed about what's going on. That's all I have. So thank you.
Just quickly, was the restaurants are inspected at least once per year? If there's a complaint, then they would either have a spot check or re-inspection. Schools and the hospitals are typically inspected twice a year because they're considered a vulnerable population. And so that's how, and then you have restaurants, in case of like a McDonald's or Burger King, those are considered a lower risk because a lot of that stuff is prepackaged, whereas a diner would be a higher risk and may have more inspections more than once per year because of a higher level of foodborne illness occurring there. And then as far as the revenues go, well, the revenues for the health department are going to be your birth certificates and your death certificates and your marriage licenses. So that's the income that we have and then the expenditures. That's a good question. Deborah, you have what would be some of the expenditures, like paper, Band-Aids, maybe?
Yeah, anything that has to do with the clinic goes under the CHC line. There's office supplies, there's contracted services such as our IT consultant, etc. What
Things.
Well, our vaccines, we get those for free in the VFC program, so we wouldn't pay for those.
Well, we
Um,
did buy extra, Jim, so yeah, there is an expense on
right, we do buy some flu
just for
shots.
flu.
Labor is virtual,
Yeah,
Yeah,
just for flu.
okay budget,
Yeah.
labor.
right. Yep. Pretty simple, not like the city council.
It's a bigger
Yeah.
budget, of course.
Bigger, yeah. You also asked a question about, new people coming into an establishment. The staff provides a food handlers course, and every establishment is required to have a food manager on site during open hours. So they have a separate course for food managers. They can't require that their staff take the food handlers course, but they do usually recommend. We've had several establishments that have done all their staff at one time in one class.
Rent a kitchen would be people going in and out on a kind of random basis.
Yeah,
Rent a kitchen for a day, a week, a month, a year. And it's up to the manager, I'm sorry, the owner of the establishment to report to you guys that something's changed.
Right,
And
so
that
it's a
would,
lot harder,
that would trigger an event like an inspection.
right?
Totally separate topic, sorry. I had heard, New Jersey's been touting this, the state of New Jersey's been touting, naloxone spray distribution or availability in pharmacies. Are there pharmacies in Englewood that are offering those sprays for free for the public? Are we advertising that at all?
Well, we give them away for free already, and, correct, Deborah? I know McBurgan, we have, we have those, and libraries could give them out,
The Narcan distribution.
yeah.
Yeah,
Local
actually,
pharmacies may have them in stock. You just have to inquire from your local pharmacies whether they have them in stock. Like just like CVS, Walgreens, any of them by the state of New Jersey are allowed to distribute them.
Thank you.
we are just about to also have I want to call it a bin, but it's a separate container just for that. It's going to be put on the grounds of the rec department. It was initially supposed to go to the library, but with their construction and everything that's going on there, the bin is too big for the location. With the rec department, that they will have it there and people can take the Narcan themselves and not have to, have somebody standing over them. They don't have to feel, stigma that somebody's going to see them.
Just want to go back to your question about the Zoom availability. Paula, how are we posting that? Or Deborah, what are we doing with that? I don't want to leave it unanswered.
So on the calendar, like even for me, when I needed to log into the computer, it's, all the meetings are posted, but you do have to go to the city website calendar. But I do recall, I was taught, I did not put it where you do put it on the agenda, and then I put a little square where it is included. So I can do that going forward. But, it is also on the calendar. Usually we try to check, because, sometimes maybe the wrong, link, or when we had to update, instead of using Facebook, now we're using YouTube. So it's there.
Thank you.
Yeah. Thank you.
Any other comment?
This, oh, I'm sorry.
Yeah, regarding communicable disease update, is that something that's posted on the city's website under the health section? Find out, I think Baldwin given some updates on COVID and also measles.
The mayor does his coffee talk points, and I know that our staff here at Inglewood sends him a report. His coffee talk points are every week. We don't put anything up on our website pertaining to communicable diseases. And with the measles outbreak, it was we had a public service announcement that was put out. So when, when you have like, a foodborne illness case in Inglewood, we don't advertise, oh, somebody got a foodborne illness. We don't do that. We just keep the data and we tally it up, and at the end of the year, we say this, many cases were investigated. So, yes and no, I guess, to the answer to your question.
Thank you.
Would you say your name again?
Ava, right again.
Or is there anyone else on the?
So, there's no
Yeah.
further public discussion. The board will need a motion and second to close the floor to public comment. So,
Second.
Ms. Bostic,
Yes.
Ms. Rubin.
Yes.
Dr. Sadler,
Yes.
Dr. Sofer,
Yes.
Mr. Tenzer,
yes.
Dr. Solomon,
Yes.
and Ms. Davis.
Yes.
And then I just have to bear with us, please.
Motion for a closed session.
I am going.
The Open Public Meetings Act of the State of New Jersey permits the exclusion of the public from closed sessions discussing employment matters. Going into closed session requires a motion and a second.
Thank you. Ms. Bostic
Yes.
and Ms.
Thank you.
Rubin.
Thank you very much for having us.
Thank you.
Thank you.
Dr. Sadler. Yes. Dr. Sofer.
Yes.
Mr. Tenzer,
Yes.
Dr. Solomon,
Yes.
Ms. Davis,
Yes.
and then I just have to. And then I just have to stop YouTube.